The anatomical forceps are atraumatic forceps with transverse grooves. Surgical forceps are traumatic forceps with small, sharp teeth at the tips. These can be used to grasp firm tissue. The DeBakey forceps have special DeBakey toothing. Because of the toothing, the forceps are atraumatic but offer more grip than anatomical forceps. Bipolar coagulation forceps are used to seal small blood vessels. They are connected to a bipolar electrosurgical unit and conduct electricity through the insulated handles to the tips. For a more detailed elaboration of this, refer to the course The Basics of Electrosurgery. Kocher forceps have transverse grooves and, additionally, have small teeth on the tips, similar to surgical forceps. They can be used for various purposes, for example, to clamp tissue or fixate suture threads. Here, curved Kocher forceps are shown. These are often used to retract tissue, for example, parametrial tissue. Peen forceps are similar to Kocher forceps, except they lack the small teeth at the tips. These forceps are most commonly used for fixating suture threads. These are regular dissecting forceps. They come with various angles of curvature and are used for dissection and to aid in a tie-on a pass. Curved forceps are firm dissecting forceps. They can be used to dissect or perforate tissue or for a tie-on a pass. The angle may vary. Overholt forceps are long dissecting forceps with slim tips, bent in an angle of 90 degrees. They are well suited for dissecting in deep wounds. Alice forceps are small and atraumatic. They are used to fixate delicate tissue. Duval forceps are, like Alice forceps, atraumatic. These are, however, broader and bigger, enabling grasping bigger bites of delicate tissue, for example in vulvar surgery. The Babcock is a pair of atraumatic forceps, ideal for grasping vital tubular structures like the ureter or blood vessels. This is a firm, straight clamp with DeBakey toothing. This clamp is used to grasp firm tissues like the parametrium and paracervical tissue. The mosquito clamp is used to clamp small blood vessels before applying a ligature. Sponge forceps are used to clamp sponges or gauzes to apply pressure to a bleeding wound in order to reach hemostasis. Pottsy forceps are sharp, pointed forceps. They are typically used to grasp the cervix. Backhouse towel clamps are, like Pottsy forceps, sharp and pointed, though bent in a curve. Originally, they were used to fixate surgical towels. Nowadays, they are used in plastic surgery to fixate flaps. Gynaecological tampon forceps are long, slim forceps, used to bring in a gynecological tampon transvaginally. The grooves on the jaw are in a parallel direction for easier insertion of the tampon. Metzenbaum scissors are commonly used dissecting scissors with curved blades to enable good visibility of the tips during dissection. The degree of curvature of the blades is variable, and the scissors come in different sizes. Mayo scissors are firm scissors, used for cutting firm tissue or suture threads. They come in curved or straight variants. In gynecology, the straight pairs are also known as episiotomy scissors. The Heger needle holder is the most commonly used straight needle holder. An advantage of the straight needle holder is that the movement of the needle follows the same line as the movement of the hand of the surgeon. They come in different sizes. The Wertheim needle holder was previously used in gynecology in deep wounds or cavities to prevent the surgeon's hand from blocking the light and line of sight. A disadvantage of this needle holder is that the needle makes a different movement, a cone, compared to the hand of the surgeon, a cylinder, making delicate suturing much more difficult. Different blades of scalpels are shown here. Blade 15 is commonly used in plastic surgery, as it is well suited for making small, delicate movements and curved incisions. Blade 11 has a pointed blade for stabbing or sawing movements. In gynecology, these are used to perform conization. Blade 10 and 21 are similar blades, but different in size. These are most commonly used for straight incisions. For a detailed elaboration on mounting and removing scalpel blades, refer to the course Basic Surgical Skills, Instruments and Handling. The Breisky speculum is used in vaginal surgery, most commonly to lift the anterior vaginal wall. Because of its bayonet form, it can be held over the pubic symphysis. The Doyen speculum comes in a broad and narrow version. The broad one is most commonly used for retracting the posterior vaginal wall and comes in different lengths. The narrow Doyen speculum can be used to retract the lateral vaginal walls. The peritoneum retractor has a long blade and a cross guard at the end of the handle. This retractor can be used to retract the posterior vaginal wall and reach into the pouch of Douglas intraperitoneally. The sympathectomy retractor has a shallow curve at the tip of the blade. It can be used during sympathectomies for retracting structures deep in the pelvis. The uterine probe is an atraumatic probe, which can be used to measure the depth of the uterine cavity. A centimeter scale is carved into the probe.